really excited to have you on as our first guest in what we're calling the POI Community Connect. So Jenn Poirier, is that correct?
Mm-hmm.
I always want to make it sound fancier than it.
You can make me sound as fancy as I want. That's how I pronounce it.
I was going to say Poirier.
I married in, so.
So Jenn has her doctorate in physical therapy from Northeastern University, started her career in outpatient orthopedics with intentions of learning sports and focusing in on sports. That would allow her to practice. So your practice philosophy is focusing on increasing independence and improving functional skills.
Correct.
As a parent these days, you are juggling homeschooling of 3 kiddos with your husband. And when you have the opportunity, you love to get outside with the kiddos and your 2 dogs.
Yes.
So the intent of our conversation today, you and I had a pre-interview chat. We talked about some of the challenges that parents are having as it relates to the pediatric care for your patients. A lot of this telemedicine, as you alluded to, and in your understanding of how this Zoom conversation or this Zoom technology works. So you're, instead of face-to-face, now you are essentially doing this via video. And so we want to talk about some of the care challenges that parents are facing and some of the things that you have learned along the way that can help parents to keep their kids moving, keep them active, and avoid some of the regression that could occur over this, next, few weeks or months, into the future. So did I cover that?
You got it. You got it.
Wonderful. Fantastic. So just start out, just tell us again, obviously I gave a little bit of the background, but what are, what's your passion here as it relates to the pediatric,
the PT world.
Yeah, the PT world.
Sure. So I have been specializing in pediatrics for the last 10, 12 years. As you said, I started in outpatient orthopedics, sports medicine. My goal going to PT school was to kind of break barriers and become a female PT with, a major league team. And through my schooling, I was introduced to this world and fell in love with it. And so this is very much where my passion lies. I love taking kids and families through their first of things, being able to sit independently and crawl and walk and take their first steps. And I have been very, very blessed to be able to be present in the room a lot of times for kids' first steps. And a lot of the kids that I am seeing have some kind of challenge that they're overcoming, whether it's prematurity or, they have some kind of diagnosis. And so more frequently than not in my world, my work world, first steps are not happening at 12, 13, 14, 15 months. They're happening at 3, 4, 5, 6, 9. And that's a really special thing to be a part of, taking first steps when they're, they have been told for so long, this may never happen. So it's really nice to be present when that happens. So my goal with every kid that walks in the door, regardless of their diagnosis or their age or anything else about them, is, okay, how can I get you independent?
That's awesome. So you're not letting the diagnoses determine your approach to the treatment?
No. Because kids are resilient and, the truth is we don't really know what they can do until we challenge them. So, independence for Johnny might look different than Sally's independence, but they both can achieve some degree of independence. It may be with a power wheelchair, it may be with a walker, it may be walking independently. And my goal for each kid that walks in the door is to kind of figure out, like, how can I get you to be moving on your own?
Yeah. So I really liked or appreciate your focus or your philosophy as it relates to increasing independence and improving functional skills. What are some of the techniques and methods and strategies that you use to make that happen?
Sure. So it depends on the child and the diagnosis, of course, and I'll just kind of run through some of the typical pediatric diagnoses that are seen throughout the country.
Great.
Um, Cerebral palsy, Down syndrome, muscular dystrophy, multiple forms of that. We see a lot of kids who have autism, spina bifida, traumatic brain injury. We see kids that were born prematurely, and or have some kind of gross motor delay. Some children who were born as micropreemies, they will have them follow with therapies early on until they know, if there's going to be a delay or not. We see children with mitochondrial disease and other related energy type disorders. We see kids with all kinds of genetic disorders. And then sometimes we see kids who don't have a diagnosis, but they present with abnormalities in gait, like toe walking, or they have abnormalities in posture, like scoliosis or torticollis, which is like when you're an infant and you have one side of the neck that's stiffer than the other.
Mm-hmm.
We see kids who present with decreased strength or have abnormal muscle tone, whether it be, their muscles are floppy, they're hypotonic, or they're real stiff, hypertonic. And we have kids that have ataxia who just kind of move in patterns that aren't really smooth. And some kids that just have motor planning deficits. So, depending on what it is that we're working on, we use a lot of strengthening techniques. We'll work on flexibility or balance or just general functional mobility skills, learning how to roll over and sit up in bed or transfer from one surface to the other, whether that's standing or from their wheelchair to a classroom chair, or whatever that means for different kids. Just teaching them really how to move so they can go throughout their day.
When we were talking earlier, you had mentioned that some of the challenges that you're seeing as it relates to the pediatric, the children that you would normally see, normally have up and going, and in going through the exercises. What are some of the physical challenges that you're experiencing? We talked about bowel movements and different things that weren't happening as a result of a lack of movement.
Yeah. So typically, if a child, a child that is maybe in a self-contained classroom or in a special setting at school, they get up in the morning, mom or dad or whoever puts on their braces, puts them in their wheelchair or their walker, or gets them set up with their crutches and sends them off on the bus. And at school, their teachers have them in all different positions throughout the day. They're in their standers. They are in their activity chairs. They're moving from surface to surface.
Mm-hmm.
Where at home, a lot of families like us here, mom and dad are trying to work. They're trying to do homeschooling and, take care of the daily needs of their kids. And so a lot of that we're seeing, kind of across the board, us PTs, is just parents struggling to figure out how, how do I juggle all of the plates, keep everything in the air.
Right.
So it's been a real challenge. But one thing I was telling you about a case I had last week is one little fellow that I work with really struggles with constipation. And, mom was telling me they had been trying all this stuff back and forth with telehealth visits with the physician, trying to figure out how to stimulate his bowels. And I suggested the stander because, we think about standing as so beneficial for the legs. And it is. But for our kids and adults and young adults who have a stander and who spend time in their standing frames daily, the benefits are not just for the legs. This is widely proven. There's lots of research on this that anyone who is welcome to can read up on all the scientific benefits of standing. But some of them are that it allows our diaphragm to fully contract so we can get a nice deep breath in and fill our whole lungs with air, which we know now is especially important given the reason that we're all home and doing these televisits is a respiratory based disease. So that right there,
I hadn't thought of that.
it's going to be really beneficial to just start off with strong lungs. But it also helps aid in digestion and help bowel movements happen a little more easily, because you think about, a lot of us are spending a lot of our days sitting now at the computer. Our whole trunk is compressed, but when we stand up, we allow our whole trunk to elongate, and everything just gets a little bit more space, and everything inside has room to do what it's supposed to do.
Yeah, that makes complete sense. And I wouldn't have thought about the challenge with the lungs, that we're not filling our lungs up fully because
Yeah,
of, being hunched over. But
compressed.
makes complete sense.
Kind of like after Thanksgiving, you know, you eat a big full Thanksgiving dinner, and the first thing you do is like lean back, and then as soon as you stand up, you feel immediately better.
Yeah, absolutely. Well, what are some, so you mentioned putting children into a standard. What are some other strategies?
Sure. So change positions. Don't just sit in the same chair all day, every day. It's not good for you. It's not good for me. It's not good for our kids. Spend time on the floor, get them on their tummies, sit in different surfaces, stand if able, walk, get around, move around. Even if, they're going to be at their computer doing schoolwork for a couple hours through the day, just kind of change positions every time you switch a subject, is a good rule of thumb.
Every time you say, okay, so that's from a frequency perspective.
Yeah, I mean, for you and I, like every hour, get up, move around, go to the bathroom, get a drink. It's the same for our kids, if they're sitting for an hour. Some kids don't have the attention span I know mine don't, to sit there for an hour. So, think about when you're changing activities for the kid, think about changing positions for them too. For kids that will work on strengthening activities, their main goal is increasing strength. You can pick an exercise for them to work on and work on it all week. Last week, I have a little boy that is really into competitions, and he's working on improving upper extremity strength so that he can assist more with his wheelchair transfers. So I gave him a competition. I told him he does a modified version of a push-up, and I told him he had to finish 100 between last week when I saw him and this week when I see him again. So if he finishes 100, then he gets to challenge someone else. Okay, this week you have to do 100 push-ups, dad or brother or mom or someone. So make it fun, make it a competition. Sometimes I will adapt board games. So Candyland is really a fan favorite in my house right now. You can make every color a different exercise. Get the whole family involved in it. When you land on red, you have to do bear walk. When you land on blue, you have to do the crab walk or balancing on one foot. Whatever exercises the child is working on in their regular therapy sessions. And ask your PT, if we do one thing this week, what should it be? Obstacle courses are another really good, fun way to work on strengthening and motor planning. Take a piece of sidewalk chalk and get out on your sidewalk, on your front walk, in your driveway, and draw a balance beam. Have them walk along the balance beam. You can draw hopscotch, but make it fun, because regular hopscotch gets boring after a while. So try and change up the pattern, or do 2 feet together, 2 feet apart, or hop on one foot on the left and then hop on one foot on the right. For our kids that are working on increasing their endurance, and they can't get out to the park to walk, or they can't get out to the state parks or wherever it is that they're used to walking, take a little activity log. This is what I've been having some of my kids do. Start a stopwatch and just walk laps around your house and see how many minutes you can go. And if you went 3 minutes yesterday, then try 3.5 today. Or dance. There's a lot of fun dance YouTube videos for kids teaching different steps of the dance. But for our endurance kids that we're working on improving their endurance, sitting sedentary is gonna really set you back. So you just need to get them moving, and it doesn't have to be for very long. So whatever, they start where they can.
Yeah.
Start with 2 or 3 minutes and then slowly build up, but just get them moving. For our kids that are learning to use mobility devices, they're learning their walker, they're learning their wheelchair, they're learning to be more independent with it. Make an obstacle course for them too, and have practice starting, stopping, changing speeds, turning. All those are wonderful skills that when we do get to reacclimate to society and being out again, they're going to need to be able to get through the doorway at school. They're going to need to be able to get into grandma's house. So this is a good time to practice. And an obstacle course is something that you can get the whole family involved in. If sibling doesn't use an assistive device, they can use their scooter and, make it something that the whole family can do.
Yeah.
Red light, green light is another one I've been using a lot via these telehealth sessions with my kids who are learning that they're new-ish walkers. And, they were steppers. They could take a couple of steps. Now we're learning to transition them to be really walking longer distances, and stopping, believe it or not, is a really hard skill to master.
Yeah.
A smooth stop instead of just a fall. So yeah. I have my green and red here. I'm set up in my telehealth spot right here. So I took my kids' buckets that they organize their toys in, and we do green light, red light, green light, red light.
While they're doing this, they're off camera and
they're walking. Yep. Okay. So I try and set them up so that they start far back from me and they walk towards me, so that they can see me, and I have something big to hold up so it covers most of the screen.
Right.
And I'll use my words at the same time too to cue them. And green means go, start going, and then we pull out our stop.
That's excellent. So obviously other physical therapists could use that. Parents could use that at home. What other techniques and strategies and creative ideas have you had as it relates to when you're in that session?
Oh my goodness. So it has been a creative challenge, one that I've tried to rise to the occasion with. So I took a picture that I can send you of my whole little workstation. Here, I have, for the kids that we're working on teaching movements, I have my little baby doll here, and I show the parent, okay, take one leg and move it across their body to try and teach them how to roll. Or when we're working on sitting balance, I have my little baby here, and we work on shifting this way and that way, and really focusing on getting the arm out so that they can learn to protect themselves. I have a stack of kids' books here that I have adapted to be motor. So I read them the story, I show them the picture, and with each page is an exercise. So I tell them the exercise, I read them the story as they're doing the exercise. And so I have, for my stories, all my little cheat sheets here of what are the exercises for each book. Yeah. And I have kind of like a one for kids that are working on higher level skills, one for the medium level skills, and one for lower level skills. So I can kind of cater it towards each kid. I've been working on a few new books a week to keep it interesting.
Right. So those are just books that you are.
There's just books that I have
sharing with a parent. So how would a parent? So your notes, I assume, they're probably scribbles in the pages on that. Okay. So how could you maybe share that to get that out there? That sounds like.
So I'm working on putting these all up on YouTube.
Okay.
In between working and taking care of my own kids, my husband has been helping me tape all of this stuff to get it up online to share this with other people. It's coming slowly, but it's coming.
That's awesome.
I'm also working on like common toys that you would have at home, a ball or a truck. Like, here's 5 exercises you can do with this truck. Here's 5 exercises you can do with this ball. Because it's hard to adapt a PT session to a house where you don't know what's there. Right. So you just have to assume there's nothing and go from there.
Great recommendation. So how, as a parent, so if I'm a parent at home, this is, pretty overwhelming. I've never gone through or performed therapy on my child before. I've seen it. I've been there, but I maybe didn't pay a great deal of attention to all the movements and activities. How do they know that they're doing it properly? If they're not on the call, what are some resources, or how would they know?
So for pediatric therapy, teletherapy, it's going to look different than teletherapy for you or I if we had a sore knee or shoulder that we're rehabbing. The parent or the caregiver or some adult is on each one of these calls with me,
Right.
because inevitably 10 minutes in, little Johnny is done. And
Right.
he either clicks the button to hang me up or just goes in the other room. So,
Right.
so mom or dad or grandma or whoever the caregiver is at that house is in the session with me. And I am coaching, I am leading, I can see them, I make sure they position me, whether they're on their phone or their tablet or their computer, like make sure it's, that's usually the first 30 seconds of the call is, okay,
Sure.
we're going to be right here. Can you see me? No, tilt me down a little bit. Because I really want to make sure that I can see around them, so that I'll see in the background, like, oh, hey, grab that toy, or, oh, hey, move this a little bit to the right, or so that they're really reaching for that. So that's kind of the first how we set up, is make sure I can see you, because I want to see what the child is doing, and I want to see how much assistance, if we're working on a balancing activity, I want to see how much assistance the caregiver is giving them, so that I can jot that down to know for next time, like, let's try a little bit less help.
Now, when you are, so normally, say you meet with a patient a couple times a week, has that dropped to one time per week, or do you maintain the same sessions? What's your schedule?
I mean, the goal is to maintain the same sessions.
Okay.
But I feel like I can speak for pediatric therapists across the board here, is we are really just doing everything that we can to keep our kids moving in the right direction. We understand that you now have Zoom calls with your child's school, and they're getting OT, so you have an OT telehealth session, you have a speech telehealth session, you have PT, you may have doctor's visits. You get it, talk to us.
Right.
Tell us what's going on. If you have a super busy week, let's do one, or maybe we'll do home program this week. The goal is to keep it the same, but we're all in this together right now. We're just trying to keep your kid moving in the right direction.
Right. So what are some of the things, so you said, reach out, talk to you. What are some of the questions that you would like for parents to ask more frequently? What would you like to hear from them as far as guidance and things that could help you be better or more effectively do your job?
Sure. So right now, I think one of the positive parts of this mess that we're in right now is parents are really watching their kids all day long. So they see what happens throughout the course of the day, and they may notice things that they wouldn't have before, because they're not spending 24 hours a day with them. And really now is the time to kind of watch, so we can fine tune things. Like, pay attention to, if your child has falls, and we're working on balancing and improving their gait and preventing loss of balance. Pay attention to when they're falling. Is it when they change surfaces from the hardwood floor to the carpet? Are they falling when they're outside walking in the grass? These are things that when you come back and tell your therapist, we'll know, okay, now we need to work on, gait is nice on a nice level surface. Now we're working on changing surfaces. Or, you may notice increased stiffness in your child if they have spasticity, or they have hypertonicity, or if they just are a child that has joint inflammation and swelling, with juvenile rheumatoid arthritis, or there's several other diagnoses that would cause joint pain and stiffness. Tell us if they're having increased pain. Mm-hmm. It could be because, like we talked about before, they may not be moving around as much as they typically had, or they may not be wearing their braces for as long as they typically do. So they may need to just increase that wear time to what a typical day pre-COVID looked like, to try and control that spasticity and preserve that joint range of motion. So for every kid, it's going to be different, but I would say just pay attention and see, you know, are you noticing improvements? Are you noticing really every day they fatigue at 2 o'clock? What can we do to keep them going until 3 or 4? Pay attention and tell us if you're having an especially hard week. We understand last week, a lot of us noticed a change in the parents last week, because we're now like 5 or 6 weeks into this. And here where we are, North and South Carolina came out last week saying, you know, there is no more school for the end of the year. So I think that just parents were kind of seeing the future. Like now we have, you know, we had 6 weeks, we had it in our mind, we could do this for 6 weeks, and now we're at the 6 weeks, and now you're telling us there's more. And so there was a lot of defeat in the parents last week. And so I try and start each telehealth visit after we get set up is, you know, do you have what you need? Do you have food? Do you have water? Mom, do you have enough coffee? Jokingly, but really not, you know, we're kind of checking in on the parents too.
Sure.
To make sure everybody's doing okay. But yeah, just tell us if it's hard and you know you can only devote 5 minutes to motor a day. Like, give me something I can do in 5 minutes, because I don't have the brain power for any more. Just, you know, be honest.
Great suggestion. Sorry, I'm just making some notes myself. I guess it is recorded. I can go back and listen. I just always like to
quite all right.
So obviously you're creating resources, you are working on that to put out there. Where else could a parent go, or other physical therapists maybe go from a resource pool to?
Yes, there are a ton. It has been really, really nice to see on Instagram, on Facebook, on YouTube. If you just type in a hashtag pediatric PT or PT or your child's diagnosis, you're going to come up with tons and tons of research. There have been new groups made on Facebook for pediatric PTs for only this reason, is creative telehealth ideas. And it's been a really nice place to just share ideas and you know, get creative and oh, you know, I use a pool noodle to do these 5 things, but I had never thought to do these other 5 things. Or here's 2 things I usually do with bubble wrap, but this person in Montana had 3 other ideas. So let's try and incorporate those 3. It's a lot of just, you know, take one item and come up with as many exercises as you can to do, and grade them, you know, from kids that can't even pick their head up to kids that are working on hopping on 1 foot 5 times in a row, and everything in between, because we see all of those kids in a day. Right. And, you know, you need to be able to adapt with no resources potentially, what you can do for each one of those kids. It is definitely a challenge.
Yeah. So if you could pick one of those resources to recommend for a parent, which one of those would you send them to, you think?
I think probably YouTube.
Okay.
And I can get you some links of some great videos up there. But sometimes those videos are a little longer, so they can really break the movement down if it's something new that you're trying. But if it's an exercise that you're doing normally in your sessions, in your telehealth sessions, ask the PT, make sure your kid is doing it right, and record it. Take your phone out. If you're on your tablet, take your phone out. If you're on your phone, take your tablet out. Have dad or older brother record it so that you know how the activity should look, so that when you go back and practice it, you can do that.
Yeah, so record it. Or even too, what do you ever encourage your patients and parents to video when they're on their own and then share?
Absolutely. Yeah.
Yeah,
especially if it's a new skill that we're working on. I get a lot of texts from parents in between sessions, like, oh, hey, we've been working on this and look what they can do now. Or, you know, kids that are learning to walk they have their arms up in that high guard position. One of the cues for us that they're gaining more strength and balance is that you'll see their arms come down. So we'll get messages from parents throughout the week. Oh, look, hey, I caught him doing this. Or, a snapshot of they got themselves into standing independently and think no one's watching them.
Yeah.
Take a picture. We want to see it. We are invested in your kid. We want them to succeed. So this break is hard for the kids. It's hard for us.
Right.
It's harder for
That's
everyone.
your fulfillment, right? You mean you do it because
Yeah.
that meaningful and fulfilling work.
Yeah, we want to see that they're continuing to move, and we want to just see them succeed.
Absolutely. So thinking of those resources again and going back to those for a physical therapist, if you could only recommend one spot for them to go to, is there?
I think probably the Facebook groups have come up for a PT. Those have come up with the best ideas for me.
Okay.
The pediatric telehealth Facebook groups.
Some of those are strong, aren't they? I mean,
yeah. And they just popped up in the last few weeks. Yeah. And it's been a really nice place to just collaborate and share. And there's people from all over on there. So it's nice to know, like, it's not just us in North and South Carolina in this position. Everyone is kind of in the same boat. One other thing I want to mention is it is not therapy related at all, but I am feeling this very much with my own kids, is talk to your kids about why they are not coming to therapy. Reassure them every day that this is not their fault. Nobody is mad at them. They are not in timeout. They are not in trouble. That is not why they're home. Just reassure them. Everybody's home. There's germs, cater it to whatever age they are. There's yucky germs out there. We don't want to catch them. We're keeping everybody safe. You're not in trouble. You want to see your friends. We know we're going to see them soon.
Right.
That's what I've been seeing a lot with my kids, is they see me in the screen and they know that I'm there, but I'm not really there, and they don't quite understand it. I'm seeing it with my patient kids and with my own kids at home. But just reassure them. And even the children who, are nonverbal and you're not really sure what their cognition status is, reassure them too, because they don't have the words to ask, why are we not going to regular PT? Why is Miss Jenn on the iPad? Just explain it to them. Every day, if you have to. That's what I'm finding with my 4-year-old. We have to go through this conversation every day. Yes, today is going to be like yesterday. Yes, there is no school again.
It is Groundhog Day.
It is Groundhog. It is every day feels like Monday lately.
Yeah. Or I find myself all the time we're asking what day is it? What day is it? What time? I don't even know what day it is.
Yes. Oh, I'm seeing that a lot in my telehealth visits too. That's another good suggestion for parents. Set a reminder in your phone.
Yeah.
Because it is very easy to forget what time, what day, what anything it is.
Are there any inexpensive tools of the trade that you might recommend parents to purchase and do an Amazon, or get it delivered to them to help them?
Pool noodle, sidewalk chalk, bubbles, a ball. You'd be amazed with what you can do with very little. Painter's tape for inside obstacle course. That way it won't mess your floors or your walls up.
Yeah. Awesome. This has been fantastic. You've given a lot of great information that will be helpful for parents as well as other physical therapists out there. Any last words, and then how can people find you and learn how to connect with Jenn?
Sure. So I have an Instagram page. I'm terrible at this. It's Energize Therapy Services. And I have a Facebook page, the same name. And I guess my lasting remarks are just stay safe and stay healthy. Keep moving forward mentally, physically, every which direction. Just keep going. This weekend, I took the kids out. We needed to get out of the house. So we did some socially distancing visiting with family in the area, and we drew a sidewalk obstacle course at each neighborhood we visited. Awesome. Through the windows with the grandparents and uncles, and just left each neighborhood with a little motor activity for anyone walking by to do. So that is what, 99 cents for a pack of sidewalk chalk.
Right. If you can find it.
If you can find it, yes. Right? It's kind of like toilet paper. But yeah, just keep moving and stay safe, and we're all doing the best we can, and have grace with if you're a PT, have a little grace for your families, and vice versa for us PTs. A lot of us just made the switch to electronic documentation a few years ago, and that was quite a challenge for some. And so you can imagine this whole new level of technology is a challenge for some families and some therapists, and just know we're all just doing the best we can.
Right, for sure. Well, one idea, or just the thought that came to mind, is obviously we're recording this and it'll live out there. As far as your sessions with your parents and patients, do you record those and share them with them in any way, or probably can't with HIPAA stuff?
No, but if they want to, they're welcome to record them, but we don't.
Gotcha. Okay.
With HIPAA.
That makes a lot of sense. Well, I mean,
I'll record myself. I'll record myself doing the exercises if they have a question on, like, oh, how do I midway through the week, if they text me, I forget what's the crab walk and what's the bear walk, I'll take video of myself and send it to them. And I'm working on getting a YouTube channel started up to put all this up there too, so that it's just readily accessible for anybody that wants to happen upon motor activities for kids.
Well, excellent. Well, you're a pleasure to talk to and a real joy, and we're grateful. We always enjoy interfacing. Obviously, my wife Brenda gets to work with you on a weekly basis.
Yes, we've been missing our Thursday visits.
Yeah. So we'll look forward to definitely getting things back to whatever the new normal is.
The new normal is, yes. I think we're all excited for that.
To grow together. Yeah, aren't we all, for sure. So thanks so much. Thanks for showing me how to use this Zoom technology.
Anytime.
And we look forward to connecting up with you soon.
Thank you so much for having me.
Absolutely. Any links, please, or YouTube vids, anything that you would have
for
us, we'll attach them here so people can reference them as well. And
excellent.
courses.
Thanks.
Thank you.